Hi there, my name is Dr. Todd Austin from Austin Family Chiropractic in Virden, Illinois, and I'd like to welcome you to this episode of the Dr. Todd Show. Today my guest, once again, we've seen her on a previous episode, is Dr. Georgia Davis of Springfield, Illinois. Dr. Davis is a neuropsychiatrist in private practice in the Springfield area for the past 25 years. She helps children, adults, and adolescents with complex conditions that have not previously responded to traditional medical treatments. We talked to Dr. Davis on a previous episode of the show about people that are told they have normal thyroid tests on the lab, but yet they have what you told our viewers about is subclinical hypothyroidism. So my question for you today is, that can be mistaken for depression type symptoms. Are there other issues that you see in practice that can be mistaken for depression type symptoms as well? In these people, obviously they do not respond to the standard selective serotonin reuptake inhibitors.
Yes, I often see patients that complain of fatigue, and that makes me think of adrenal fatigue. The adrenals are glands that are responsible for helping us meet stress. And when a person has had unremitting stress, medical illness, surgery, some type of accident, then the adrenals come into play. And if we have strong adrenals and the stress doesn't last very long, then we generally recover and do fine. But sometimes the stress is unremitting, and people find that they get more and more tired. In fact, they get fatigued. They get exhausted when they do very little. And that pattern tends to be something that we need to watch for, because it will prevent a person from getting a robust response to antidepressant medications if it has been missed. And it often also prevents us from getting a good response when we treat the thyroid. If we give thyroid hormone to a person with weak adrenals, they will get worse. So we need to make sure that the adrenals are strong enough to be able to handle the treatment of the thyroid. And so the adrenals are very, very important.
Yes, exactly. So, and I see, as a chiropractor, I see a lot of adrenal fatigue with my patients as well. So that's something that I check them for as well.
Well, because you treat pain.
True.
And pain is constant and chronic. And if a person has pain over a period of time, it will wear down the adrenals.
Exactly, yeah. And it will cause them to be, as you said, fatigued.
Yes.
So how would you typically diagnose adrenal fatigue, Dr. Davis?
I ask my patients not only if they are tired, but if they have lightheadedness when they stand up. If they're lying down and they stand up, or if they're sitting and they stand up and they feel a little bit lightheaded or dizzy, that's tip-off. And in my exam, I can ask them to give me a supine blood pressure. That means a blood pressure lying flat.
Face up.
Face up. And then I will stand them up and ask them to tell me if they feel lightheaded. Ordinarily, a blood pressure consists of the systolic pressure, which is the number on top. That reflects the pumping pressure. And the diastolic pressure, which is the number on the bottom, and that reflects the filling pressure of the heart. When we go from a supine position to a standing position, the numbers should change by increasing, when you're standing, by at least 10 to 20 millimeters of mercury. So if it's 110 lying down, then standing up it should be at least 120 on the top. And if it's 60 lying down, it should be at least a 70. If it's not, sometimes it will rise, but it won't rise the required 10 units. Other times it won't rise hardly at all, and of course that's worse. And sometimes the worst of all is when someone stands up, feels lightheaded, and it actually drops.
True.
Now, in order to make sure that that's reliable, we have to make sure that our patients are well hydrated. But I can do that very easily because I take their weight on a body composition scale. And the body composition scale tells us how much of their weight is actually water, that is how well hydrated they are, how much is muscle, which we'd all like more of that, and how much is fat. And so it is a nice baseline, because as people start to get better, either from thyroid or adrenals, then the weight redistributes and they become better hydrated and they develop more muscle, better muscle tone, and they lose the fat, which of course when they lose fat, they also release the toxins in their bodies that have accumulated.
True.
So that is a really good test. We have another one. Shall I tell you about it?
Sure. And that test, by the way, I know it is Ragland's test, the one that you just described.
Yes,
So
yes.
I do that a fair amount in my office
Do you really?
as well. So.
It's a wonderful test.
Oh yeah, definitely.
Quick, easy, and people can do it at home, because a lot of people do have blood pressure kits at home. It's a good
Exactly.
idea.
Nowadays they do.
Yeah.
So. And what was your other test you'd like to tell us
Well, the other
about?
one is equally easy. You take a flashlight and you shine the light in the corner of the eye. Now it's good to do it in a darkened room or in a fairly dark room.
Dim.
And you look for, the pupil to constrict when the light hits it. A strong adrenal will be able to hold that constriction as long as you have the light there. But a person that has problems with adrenal fatigue, you'll see that pupil constrict at first in response to the light hitting it, but then it will bounce back up and dilate. And it will try again.
Oh wow.
And it will constrict, and then it will go back. And it just kind of wavers back and forth like this.
Wow.
And it's something that they can follow at home, so that as they get better, they will see that it's able to hold that constriction longer.
And it's nice that we can give patients something where they can get involved in their care and they can check these things at home.
Definitely.
Instead of just having to go to the doctor all the time for these things.
There's one other thing that they can do in working collaboratively with me that's very, very helpful, and that allows them to chart their progress. And that is back to the temperature that I had alluded to when we were looking at thyroid. This time we have them take their daytime temperatures, because that's when stress occurs during the day.
True.
And so the first adrenal temperature of the day is taken 3 hours after they wake up and start moving around. So if they wake up at 7, the first adrenal temperature of the day is at 10 o'clock. The second adrenal temperature is taken 3 hours after the first. And the third and final adrenal temperature of the day is taken 3 hours after that. Now, putting it on a chart, they will first average those three temperatures. So they will have one average temperature. And that is what they put on the chart. A strong adrenal will be able to keep those temperatures steady day to day, but weak adrenals will start to fluctuate and you will see a zigzag pattern. And we don't want that to fluctuate more than 0.2 to 0.3 degrees. And so if we see that, then we know that we have arrived at enough stability of the adrenal glands to be able to increase the thyroid hormone and not make the patient worse.
And it's
So knowing
definitely
these
good to
little
know
tricks
that.
are really
Oh,
handy.
yes, definitely. And lastly, Dr. Davis, that was fascinating stuff, by the way. But lastly, how do you typically tend to treat adrenal fatigue in your practice?
Well, like anything, sometimes the easiest things are the hardest things to do. Our lifestyle changes can have a tremendous impact on the recovery of the adrenals. But physicians can help as well. And sometimes naturopaths will use herbals like ashwagandha or rhodiola or relora, or a combination of those herbs, which are very good. But if a person has pretty severe adrenal fatigue, then sometimes we'll need to give a pharmaceutical form of Cortef or hydrocortisone. Now, that is a bioidentical medication that is made that is very, very different than the steroid medication that would be given in the instance of adrenal problems by a traditional physician. Steroids have many, many side effects that we would want to avoid. And in the end, it destabilizes the mood, it makes a person more prone to infection, and it has many disadvantages. But the bioidentical hydrocortisone or Cortef differs in the chemical structure and has only advantages if it is dosed properly. And it can be a wonderful boost and shorten a person's recovery, and then the herbals can take it the rest of the way home usually.
Sounds like a lot of good information. And in my practice, I don't do a ton with adrenals, but we tend to use adrenal cortex glandulars, sometimes some DHEA as well. So there's a lot of different approaches.
Yes.
Versus just, like you said, taking the pharmaceutical meds that are typically given.
Yes.
So I would like to thank you once again for being on the show, Dr. Davis, and a lot of excellent information about adrenal fatigue that I think a lot of our viewers should know, being as this is year 2013 and a lot of people are just pretty stressed out.
That's right. It's a pleasure. Thank you very much for inviting me, Dr. Todd.
You're welcome.